Good afternoon, everyone, and thank you for joining us for our third Wellbeing session. We're absolutely delighted to have the Cabinet Secretary for Health and Sport, Jeane Freeman, MSP, here with us this afternoon. Before we get started, and I bring in the Cabinet Secretary and our host, Laura Boyd, I just want to give you a brief update on Cancer Support Scotland. We're here to support the well-being of everyone affected by cancer across Scotland. We're doing this by providing telephone and digital counselling to those affected by cancer and their carers. We're also developed with our expert team a range of self-help guides, and these are in the form of digital, audio and written guides, and these are accessible via our website. And we've also developed a range of stress management tools, and these workshops are 5 weeks in length and they're completely free. And what's unique about these is if you're a carer for someone affected by cancer, you can also access these workshops. So if you need more information, please do visit our website, cancersupportscotland.org. As well as that, the Scottish Cancer Coalition have got together and have produced a useful fact sheet on a range of services that are available across Scotland. These range from financial and cancer-specific resources, and this fact sheet is available on the Voluntary Health Scotland website, vhscotland.org.uk. Without further ado, I'm going to bring in our host for today, Laura Boyd. Good afternoon, Laura. How are you?
Good afternoon, Rob. I'm very good, thank you. How are you?
Yeah, I'm not too bad, thank you. Not too bad at all. And thank you for joining us for our third Wellbeing session. And we're delighted to have the Cabinet Secretary with us. So I will leave you to introduce the Cabinet Secretary and enjoy your afternoon.
Thank you very much, Rob. And lovely to meet you, Cabinet Secretary. How are you today?
I'm very well, thank you. And I'm delighted that having had to cancel it the last time we were due to do this, that we've been able to rearrange it quite quickly. But let me take the chance to just say personally an apology to you and to everybody that were maybe a bit disappointed or certainly a bit inconvenienced by the fact that I had to cancel it last time. So I'm glad to be here.
I think everyone understands it is a very, very busy time for you, so we're delighted just to have you here. And we've had so many questions come in for cancer patients. Obviously, it's a strange time because we're starting to see the ease of lockdown and the ease of shielding, which is a good thing for many people, but also I think particularly for cancer patients and those that are vulnerable, it brings with it a whole raft of other questions. So we've had quite a few sent in, and without further ado, I'll start going through them. So on the topic of well-being, Richard got in touch to say, we know that this is only the tip of the iceberg in terms of the long-term impact this situation is going to have on people's mental health, especially for those living with cancer. What can we be doing now for ourselves and our loved ones to ensure they are looking after their well-being?
It's a really, really good question, and a really good question to start off with. There's no doubt we've been dealing with this and worrying about this for months now. Everybody across Scotland, but particularly people who already have a lot else to worry about because they have cancer. As if that's not enough on your plate, to then have this too must just feel at times not only frightening but probably a bit overwhelming, and at the very least you'll be a bit scunnered with the whole thing. And I completely get that. I think the first thing to do actually is just to be a bit kind to yourself. You know, being scunnered about it, being angry, anxious, frightened, fed up, that's just because you're a human being. And those are exactly the right reactions, understandable reactions to have. So don't be hard on yourself or impatient about it, please. There are resources. Rob has just gone through a number that are offered by Cancer Support Scotland, and of course the Cancer Coalition, the Scottish Cancer Coalition, has done so much to realign how they can offer support to people. Probably the initial one I'd suggest that you might want to think about is the Clear Your Head campaign that Scottish Government has and runs, and you can access that. And that's really just to give us all a bit of breathing space, a bit of ideas and tips just to step back for a moment and let all that noise in our head calm down for a bit. That might be going for a walk, it might be reading a book, it might be just sitting outside for a wee while and just observing everything, you know, and paying attention to it. A bit of mindfulness never goes amiss. So I suggest that if you haven't checked that out, you think about doing it. Exercise is good. A bit of a regular routine is good, gives us a structure to our day, and makes the week and the weekend maybe feel a bit different, because the risk is it can all run into itself and we don't know where we are half the time. So there are things to do, but the most important thing is, please don't be hard on yourself, just because there are times when you are tearful, overwhelmed, or just plain scunnered with it all.
I think it's a phrase we hear a lot just now, but it's, you know, it's okay not to be okay. I think that is something that we should all kind of, you know, live by. And I've also done some work actually with the Clear Your Head campaign. They've got brilliant tips on their website and simple things. I did a thing for them where I was just baking, and just that thing of having something to focus on for a couple of hours takes your mind off everything else. It's really good, so it's definitely worth checking that out. Now, on that same topic, we had a question from Lauren. She said, what do you think the long-term implications, mental, physical, social, or otherwise, will be for people affected by cancer during this time? And what do you think will be needed to mitigate them?
Mm-hmm. So one of the things that we are learning, I think, you know, we have to remember this is still a new and a young virus. It's new to all of us. It's undoubtedly new to scientists around the globe, although I don't think the scientific community around the globe have ever worked so fast to try and understand what this virus is all about and what is the degree of risk that it poses for us. But it's still a new virus, and as it goes, we're learning particularly about the physical impacts, the long-term physical impacts for people who have the virus and then recover from it, but that recovery can take a long time. So there are undoubtedly physical impacts that will produce new demands on the health service, and we're planning for those. The mental health impacts, there's two ways of looking at this. I have a hope that because we are more conscious of the mental health impacts of the virus on us and the lockdown period and the shielding that we're asking people to do, it has to be the hardest thing of all for people to be doing. I have a hope that that helps to reduce the stigma of mental health, and it helps us to be more personally conscious of our own mental health in the same way as we are conscious of our physical health. So that's the plus side. It's certainly making mental health and well-being a central part of what I and my two ministerial colleagues, Jo and Claire, are thinking about all the time. It's a big bit now of our work to remobilise the health service, all those services that had to get paused so we could get ready to deal with the pandemic. Social, well, I imagine, and I know anecdotally from friends and family, that one of the downsides, if you like, of the recent period has been that people have felt quite isolated and quite alone at times, particularly if they are also dealing with other critical issues like having cancer, where maybe some of the support groups and so on that might have been available before are not physically there. So social isolation and loneliness, I think, is a big issue that we need to pay a lot of attention to. But the other side of that is that we have seen quite remarkable responses from local communities, from neighbours and friends, some of the volunteer work that has been initiated in responding to what's needed locally, and of course organisations in cancer organisations, Cancer Support, Macmillan, others, who have simply just just moved what they do in order to make it work for people as best they can in these kind of restricted circumstances. So I think there are pluses that I want us to hold on to as we try and deal with some of the negative impacts of dealing with the pandemic, and remembering, of course, that the virus hasn't gone away, and it's every bit as dangerous and risky for us, but particularly for people who are dealing with cancer and other long-term or serious conditions, critical conditions, particularly serious for all of those folks too.
Yeah. And as things are beginning to be reinstated again, and more appointments are happening and things, is it likely that there will be more counselling available for people, with the kind of mental health impact and with it being such a big issue just now?
So my colleague Claire Hockey, that I just mentioned there, is a Minister for Mental Health, a former mental health nurse, a very senior nurse. So she is busy working on what she calls the mental health transition plan, and that is looking at, so a number of things that we committed to doing we couldn't follow through on because we had to completely reposition the health service to deal with the pandemic, the first phase of the pandemic. But what we're really keen to do is, as we restart those, not just pick them up where we left them as if there hadn't been a pandemic and as if we don't still have the virus to deal with, but factor that into what we intend to do and what we're restarting. So she's got her mental health transition plan. She's not yet finally satisfied with what's in it, but that will pick up on some of these issues, and we'll make sure that Cancer Support Scotland know what's in that plan. I've not been directly involved in it, but I will certainly check that I'm sure this is the case, that in thinking it through, she's taking the views of organisations like yourselves, so that she can make sure that what we can do is tailored to people's particular needs.
That's great to know. Now, moving on to the subject of testing, we had Carol get in touch, and she said, is there any update regarding antibody testing? There was a lot of hype about this, and now we don't seem to hear as much.
I hope we didn't engage in that hype. You're right, there is a lot of hype about it. There has been, and every now and then it makes a reappearance. So antibody testing has the potential to be really important. What it can tell us is whether or not we have antibodies and therefore a degree of immunity to any particular virus. And it can, to an extent, depending on how good the test is, tell us how long that immunity might last for. The problem right now is that the current state of antibody testing is that it isn't yet good enough for us to answer those two important questions. Do we get immunity? And if we do, how long does it last for? Is it like the flu, where we can get the flu every year, and having got it one year doesn't mean we're not going to get it the next year? Or is it like measles, where being vaccinated against measles has made a huge difference to the prevalence of that disease in children and young people, and indeed in later stages in adults? We don't know yet. So we don't have antibody tests ready to go and be used on people because they're not good enough and they don't answer those two key questions. What we're doing here in Scotland is we're doing antibody testing work on blood samples that are taken from patients for other purposes, using a little bit of that blood that's taken and running serology antibody tests on those as part of the overall research to try and improve antibody testing, so that we can actually get a test that would be of value that we could then start using in people. But we're not at that final stage yet. So we're busy on the research side to try and help us get to that point.
And do you have any indication as to roughly when it might be ready, or is that just a moving feast at the moment?
It's kind of no. The straight answer is no, I don't. And to say anything else is not accurate. I do know that everyone accepts, from the researchers and the scientists and so on, the potential importance of this, but it's only valuable if we can rely on it. It's a bit like the current antigen test, the test that tells you whether you've got COVID-19. That test is hugely efficient, if you like, in terms of detecting the virus and detecting that particular virus, the COVID-19 virus, in amongst any others that you might have. So it is if you like, a cracking test, good one. So we use it for those purposes, and we rely on its results because it is so good. At this point, antibody testing isn't even close to that, but the work is going on. Knowing that you've got immunity is one thing. The really important thing to know is, how long do you have immunity for? So I don't want a test that would tell me, for example, I've got immunity to COVID-19. If it can't tell me that immunity will last longer than next week, it's not telling me anything very much. So that's the key element. How long does immunity last?
In a similar vein, and a question that I thought was really, really good actually, was from Heather. She said, when a vaccine actually comes out, will those for shielding be given first priority, including those with cancer? So I guess obviously that's what happens just now with the flu vaccine. People like me with cancer get to have that first. Will that be the case with a vaccine for this?
Yes, it will. Yes, it will. Because the kind of decisions that are made about the use of vaccines are clinically driven. So they're not, you'll be pleased to hear, not made by politicians like me, they're made by clinicians. And what they always do is prioritize those who would benefit most from having the vaccine. And that are those people who are most at risk of serious ill health or death if they got the virus against which you're being vaccinated. So in exactly the same way as the flu vaccine, then the use of this vaccine will prioritise, even if we could have vaccinated the entire population of Scotland, and who's to say that that might not be where we get to? I don't know that. But even if we could, all 5 point whatever million of us there are, the priority groups to get it first, to be at the front of the queue to receive it, will be clinically led, and that will be very comparable to, for example, the current flu vaccine.
Well, I think that will reassure a lot of people, so that's really good to know. Now, on the topic of caring, Lauren emailed us and she said, lots of people have had to take up increased, more intense caring responsibilities for their loved ones with cancer without support of family or friends. What support would you like to see in place, Cabinet Secretary?
So, well, there is quite a lot of support available already for carers, and if this is something that if you like, you're new to, that you've taken on these responsibilities for the first time because of the current circumstances, I'd really strongly urge you to find your local carer organisation and get in touch with them, and they will help you with financial support, with personal support, with various support based on experience from them as a carer organisation composed of carers. When I was Minister for Social Security, I did a lot of work with carer organisations as we looked at what additional financial support we could offer to them, and so that is available. And those organisations themselves have received additional financial support from us in government to make sure that they can do the job that's needed right at the minute and survive all the way through, because of course lots of organisations that get a degree of income from fundraising at the minute aren't able to do that. So those really important third sector independent organisations are getting support from us to help that continue. So if it's new and this is the first time you've taken on those carer responsibilities, please get in touch with your local carer organisation. If it's something that you have been doing and you're doing more of it now, then I'm hoping that the carer organisations, because of the additional support we've been able to put to them, are able to give you what you need. A lot of that goes back actually to some of the earlier questions about trying, and I know it's really hard, trying nonetheless to make some time for yourself, because that will give you a degree of resilience, if you like, to do the incredible job you are doing, which is supporting your loved ones.
And I'm sure we can get the details of carer organisations on the Cancer Support Scotland website for anyone looking for that help. Now on to the major topic of shielding. Now obviously big announcement from yourself yesterday about that being eased. That's great news for many people, but also for others there's a nervousness there, understandably. So we've got quite a few questions on that topic. Isabel said, I have cancer and I've been shielding. I'm also a passionate teacher. With schools due to go back face-to-face from August, what support will you give to me to ensure I continue to teach safely and ensure I'm not penalised?
Really important question. There is, so my colleague John Swinney, who is the Education Secretary, is working on the education with an education recovery group. So that's made up of, the unions and local authorities, all those people responsible for education. And he has working to him a group of people led by Carol Tannehill, who is an advisor to government, but a real public health expert, looking at all the issues around the virus and schools restarting. You'll know our intention is from the 11th of August that schools can restart full time, and the blended model is the contingency plan. So it's not just about what's safe for pupils, of course, it's critically what's safe for all staff. So Carol is working on that, bringing in good quality public health advice from the rest of our clinical advisors and also her own knowledge. So she will be coming back, I think, very soon to me to tell me what she needs us to put in place. There will be this, I guess I was going to say the usual precautions, you know what I mean, the additional measures that will be needed to make sure that there can be lots of hand washing done at appropriate times, that the work is done on physical distancing, both between pupils, but also between pupils and staff. Will be some consideration about, for example, in a school kitchen or amongst non-teaching school staff, what precautions should be taken so that adult-to-adult transmission can be minimised, as well as the most up-to-date current scientific evidence on the risk that children pose to adults in terms of transmitting the virus. And at the moment, all that evidence is telling us that that risk is very low, but the adult-to-adult risk is the same in a school as it is anywhere else. So exactly what Carol will want us to do, I don't know yet, but she is working through that, and I know that she intends to make sure that she gives us that advice in plenty of time for us to be able to put whatever those measures are in place.
That's great. Hopefully that answers your question, Isabel. We should have an update soon. Now, Anne-Marie said, I'm a deputy head teacher and have been following the shielding rules carefully. If shielding ends on the 31st of July, will I be able to return to school on the 11th of August? Also, I have a son who's 12. Will he be able to return to school as well? So
the answer for Anne-Marie is that if all the evidence takes us safely to a place where we can say to everyone in the currently in the shielding group, it is safe for us to pause shielding, and the really important word there is pause, because if the virus takes off again, then we'll be back wanting you to step back from that pause. But if we can get to that place, then you will be able to return to work. What we're saying to employers is that the work environment needs to be COVID safe. So there's a big responsibility on employers to make sure that they are following all the advice and guidance that we are giving them. So that should work for you. Although I appreciate that whilst there's a bit of a mixed feeling here, isn't there? There's a desire to come out of shielding and a huge anxiety that goes along with it. And I get that. As far as Anne-Marie, as far as your son's concerned, I can see no reason why not. That's why we've made some of the steps, initial easing that we have done with effect from tomorrow, so that your son can go back to school. I hope for more than 2 days. I hope that we have got to a stage for his school where he's back full time. But there would be no reason, if we're at a point where it is safe for you to go back to work, and that's our advice, it's safe for him to go to school.
From Elizabeth, she mentions, as you mentioned there, that kind of fear element. She says, I'm in the shielding category and I am terrified about returning to work because I work in a hospital. I would like to think the government will continue to extend the shielding category a bit further until I can safely be assured that returning to work, that the virus is not lurking behind the scenes in a hospital setting. Can you confirm this?
And I completely understand what that anxiety might be, because there can be no question that in a setting like a hospital or a care home, even with all the testing and all the other measures we've put in, infections happen in hospitals, and that's no reason to think that good infection prevention and control isn't being followed, and all the other measures that we want aren't being followed. They will be, and you will still get infection in hospital by the very nature of it being a hospital setting. What I'd say to Elizabeth is, I don't know yet, Elizabeth, if we will be able to pause shielding at the end of July. We will work that through very carefully indeed. But one of the important things we've committed to everyone who is shielding is that there will be very specific risk assessment and advice for each clinical group that is within the overall shielding group. And we're working really hard to be able to make sure that you can access via an app, probably, if you like, a direct information about the level of the virus, where you live and where you are wanting to go, so that you can make your own risk judgments, if you like, about whether, if you're in Glasgow, whether it's okay on Saturday to go to Perth, for example. Now, we're not there with all of that yet, and I'm very conscious that there aren't that many weeks till the end of July. So once we get closer to that, we'll make a decision about whether or not we're pausing shielding on the basis of all of those factors. And we'll let people know. In addition, of course, there is the individual judgment of your healthcare team. So just in the same way that individual healthcare teams had a responsibility to add people onto the shielding list that may have not been in one of the clinical groups, then they can also have a responsibility to advise people that even if shielding broadly has been paused for an individual in their particular circumstances, they should continue to take some shielding measures. And then we need to make sure that employers recognise that and understand it and don't penalise people for doing it.
Yeah, I think that's the big worry for people. Do you see it? Obviously, as you see, time is ticking on as we head towards the month. Do you think realistically that it will be extended for people shielding?
I genuinely don't know that. It may be that we get to a place, because of the prevalence of the virus in the communities across Scotland as a whole, that it continues to decline, that we are able to pause shielding for the majority of people. But that individual clinical group bespoke advice, which I don't yet have, is really important. So it may be variable depending on which clinical group you're in. And it may be variable even within that, depending on the degree to which you have the condition that you suffer from. So there really is a mix here of the overall clinical advice per clinical group and the individual advice to each person, as well as what we can then provide, like I said, that kind of weather forecast about what does the virus look like in these different postcodes. So at this point, I don't know that. And I understand people watching this will be sitting thinking, well, for goodness sake, it's only 3 weeks until the end of July. The only comfort I can offer you is to absolutely assure you that if two things. One, if we're not ready and I'm not confident, we're not going to be doing it. And secondly, genuinely, you have no idea how fast this stuff works at the minute inside Scottish Government. It is a pace that is unknown. And I should take the opportunity to commend all of the folk who work in health in Scottish Government as well as in boards and elsewhere, because they have literally been working their socks off for 7 months now, and things do move fast. So I know 3 weeks feels like it won't be long, but I literally get updated information and decisions to take, not just daily, but within the day. So I am confident that some of what I am telling you, we will get to a place where we can make decisions in time. And by in time, I mean giving you notice, not telling you on the 30th of July what's going to happen on the 31st.
That'll be good to have. Final one on the topic of shielding quickly. We have William. He said, I've had radiotherapy in February. I'm still on hormone injections and tablets daily. I've been off for 12 weeks. Will I be able to go back to work?
So broadly speaking, I think, William, my broad answer would be yes, but I'm not your clinician. And I'm not your healthcare team. And it is an incredibly long time since I was even a nurse. So my advice to you is talk to your healthcare team. Within the broad work that we're doing about the level of infectiousness in the community and all of that, and where we get to by the end of July, even given that, you've just given me a good example of what I've been saying. There are individual circumstances where you absolutely need to take the advice of your healthcare team, because they know your case, your situation, and you a great deal better than I do. So don't rely on me to give you that advice. I wouldn't rely on me to give me that advice. Talk to your healthcare team. They'll know what's right.
Yeah, and I can only speak from a personal experience, but I know throughout this, my team at the Beatson have been absolutely incredible, and they've been in touch on the phone and email and things. So definitely, if you've got specific questions, I would seek them out. They are there to help. Now, another big topic, social distancing. I think this is one still that people are confused about, because there's so many different things happening. Obviously, it's different south, so a few questions there to get this cleared up. Joan said, are different family members allowed to visit people on their own at different times, or is it one household only?
So for the group of people who are shielding, from tomorrow, you can meet outdoors with up to 8 people from 2 households. And you could do that more than once in a week. And you can also use the toilet facilities of the house that you're meeting outdoors with, if you follow me. And if those 2 households were coming to you, then they could use your toilet.
Okay, I think you've kind of cleared it up there, but Patricia, just to reiterate for Patricia's particular question, she says, now that we can meet up with another household outside, just the same household, or can you meet with other households outside in your garden, maintaining 2-meter distance, but on another day?
Yes, you can. Yes, you can. You don't have to, of all the folks that you would want to meet, the households you'd want to meet, you don't need to pick one and stick with them. You can meet, so you could meet 2 of those households in one visit outside, 2 meters, absolutely. But then later on, you could meet, in the week, you could meet a different 2 households. So there's lots of opportunities there to get fed up with each other and bring other folk in.
It's not just that bubble where you have to have one selected family. Now, I've got quite a detailed question for you, but we thought it was an important one to put in. It's on the subject of life insurance, and it's from Alison. So she says, are you aware that people who have incurable cancer are having their claims for life insurance rejected by insurance companies, as their terminal illness policy states that you must have a disease that is incurable and life expectancy of 12 months? Cancer is a very individual disease. Some people respond well to treatment, live longer, whilst others on the same treatment may not. Oncologists make a decision on life expectancy based on an average number of trials. In a lot of cases, it's almost impossible to determine someone's life expectancy, but insurance companies make decisions on claims based on an average. This, in effect, means people do not meet policy criteria, but could potentially die sooner, not knowing their loved ones are provided for financially, which causes a huge stress as people have to spend valuable time, potentially in their last days, arguing with an insurance company, added to the stress of coping with cancer. People with incurable cancer should be able to have a quality of life and know their loved ones are provided for, as this is the purpose of life insurance policies. Can the Minister address this issue of removing this very unfair criteria of 12 months?
I'm afraid I can't directly, because it's about how life insurance policies work, or companies work, and how they determine their particular policy position. But what I can do is support a case to them to make that change. And I'm very happy to do so. And if Cancer Support Scotland wants to send me in some details about it, I'll also talk to my colleague, Ms. Hislop, who is our Economy Secretary and deals direct with all sorts of businesses, about what she might be able to do as well, to try and put the case to them that really they should change that policy.
That would be great. And finally, we're running out of time, sadly. We've had so many questions, but I'll quickly get this one on the subject of trials and research. So it's from Jeane, and she said, when will redeployed cancer researchers be able to return from COVID positions to cancer research roles, and when will clinical trials resume?
Yeah, so both are really important. When people will be able to move out of the COVID roles that they have gone into, and I'm really grateful for people being able, health staff being willing to do that, depends on each individual health board's local mobilisation plans. So we have, I published a framework for decision making for the NHS to remobilise, to recover, and actually to redesign some of its services and patient pathways, whilst at the same time being holding capacity to deal with an increase in COVID cases if that comes. But within that, each board has its own local plan about what it's going to do, and that inevitably has a consequence for how it wants to redeploy staff or release staff from redeployed roles. So your health board, your own health board, is the best place to ask that question of them. In terms of cancer trials, our chief scientist, our chief scientific officer, Professor Crossman, is busy looking at restarting his assessment of bids for research support, which includes trials. He's in contact. A lot of the cancer trials are UK-wide, often with connections into other parts of the world, of course. So it's not entirely at our hand when those trials start, but he is pushing quite hard to get all sorts of clinical trials, but obviously including cancer-related clinical trials, restarted, and at the same time restarting his own work to provide funding support for research.
Well, Cabinet Secretary, we sadly run out of time, but thank you so much for that. It'll be so informative and helpful to a lot of people, and we look forward to seeing how it all progresses in the coming weeks.
Laura, thank you very much. Can I just say, if there's any questions that you had that we didn't get time to answer, just send them in to me and we'll get the answers back to folks.
That would be fantastic. Thank you for that.
Pleasure.
Okay, folks, well, thank you very much for tuning in to our third Wellbeing session. It was a very informative one and some really important information there, especially that news about a vaccine as well, which will be very much welcomed for those at risk. Cabinet Secretary, I appreciate you're a very busy person. Thank you for rescheduling for today. We really do appreciate it, and thank you for your time this afternoon. And Laura, once again, questioning was absolutely top notch, and thank you for your time. So have a good afternoon and enjoy the rest of your day.
Thanks very much. Bye-bye.
Take care. Bye-bye.